Good morning. We will call the June meeting of the Board of Health to order. For the record, there's a copy of the Open Meetings Act on the north wall of the legislative chambers. And also, there has been a notice of official meeting provided to the Daily Record. So with that, we'll have roll call.
Wade.
Here.
Festerson.
Here.
McNally.
Here.
Rogers.
Here.
Weiss. Jones. Wilkin.
Here.
King. Espinoza.
We'll do item 2, and that is approval of the minutes from the May meetings. A motion to approve. Motion by Wade. Second by Wise. Roll call.
Okay. Wilkin.
Yes.
Wade.
Yes.
Rogers.
Yes.
Weiss. McNally. Espinoza. Festerson.
Yes.
Okay, with that, we will go to the consent agenda. Note that item C is going to be removed for more work. And with that, with the removal of C, is there a motion to approve the rest of the consent agenda? Motion by Wise, second by Wilkin. Seeing no questions or concerns, roll call.
Festerson.
Yes.
McNally.
Yes.
Rogers.
Yes.
Wilkin.
Yes.
Espinoza. Weiss. Wade.
We'll go to item 4, which is presentations and the annual State of Public Health report from Dr. Hughes.
Good morning.
Good morning.
Give me just a moment while I get this shared. All right, I think we are ready. So today we are going to be covering the 2025 State of Public Health for Douglas County, Nebraska and the Omaha Metro. And this primarily covers 2024 data, so hopefully you get a good idea of the concerns that are happening from a health perspective here in the community, and also get a good idea of what we at Douglas County Health Department are doing towards those things. All right, just to start with, our big goal for Douglas County is that our residents will live in the healthiest Midwestern metro by 2040. So it's a big goal. This is a goal that we set in late 2023 and have spent a lot of 2024 really starting to lay the groundwork necessary to help us move towards that. And we recognize that this isn't something that Douglas County Health Department does all on their own. This is something that takes the entire community and collaborations with many, many organizations and individuals across Omaha. And we are going to get there by being committed to being people first, belonging, innovative excellence, and integrity. And those are our core values at Douglas County Health Department. So for us to be the most efficient, we have to be strategic. This requires us to take stock of where we currently are, and understanding the foundational public health services might be a helpful starting place as we frame this discussion. So the graphic that you see there to the right is the foundational public health services that we use to really guide how we function as a public health system, and then of course how we function as a public health department. And the nice thing about this is that this is something that FAB uses to evaluate us. That's the Public Health Accreditation Board. Of course, we were able to get full accreditation earlier this year, so we are pretty confident in our ability to fulfill the pieces in this model, and we'll be just kind of covering things that fall into this model today. And so you're going to notice in this that there are some circles at the top of the range, and these are different community specific services. So our programs really are where where will fall under this part of the model. So things like communicable disease control, chronic disease, environmental health, these are all services that are pushed directly out to our community. And then if you look at those squares at the bottom, those are our foundational capabilities. So we also have work that's happening in each of these squares down below, and that's really the foundation that allows that work in the circles to happen. So just keep that in mind today as we talk through the various items that we'll be discussing. Some of the programs that we have that would fall into those boxes would include things like performance management, quality improvement, workforce development, our EPI and preparedness people who do a lot of the surveillance, public health emergency preparedness, and then our overall administration really falls into that group. And we actually see that the community health assessment does a great job of kind of measuring and helping us think around that top part of the model, and our strategic plan really helps us to think about how we're moving forward in the bottom part of that model. So you're going to hear a lot about strategic plan and our community health needs assessment, which we're actually going to start with first. So you guys were able to see the presentation last month about the adult community health assessment, and again, this kind of informs that programmatic work that we're able to push out to the community. So just a quick refresher though, this is to evaluate the health status, the behaviors, and the needs that we have in our community. It is data-driven and systematic. We try to keep the model as much the same as possible from iteration to iteration so that we can compare our data across time periods. This is the Omaha Metro that is surveyed in this report, and this is covering a region. So we do it a little bit differently here. We don't do one just only for Douglas County Health Department or Douglas County, but we actually include Douglas, Sarpy, Cass, and Pottawatomie counties because all of them make up the metro area. And in this past iteration, we had several areas of interest that floated to the top, including access to health services, substance use, nutrition and physical activity, mental health, infant health and family planning, and then the social determinants of health, which is a really big one. So to start with, we're going to talk about the concerns in the community around access to health services and really what we at Douglas County Health Department are doing to help with that. Most Omaha Metro residents recognize that access to health care is a problem here in our community and cite affordability, ability of provider to find providers, and appointments, insurance, transportation, and overuse of emergency departments as some of the growing issues here in our community. While 8% of Metro adults report no health coverage, the good news is that is a trend that has actually been decreasing over time. So you'll see in 2011, a little over 12% of adults in the Metro reported being without health insurance, and we are down to just under 8%, so that's a good trend. However, the goal would be 0% uninsured or uncovered adults in our metro area in order to assure good access to health services. Unfortunately, with the current federal landscape and proposed cuts to programs like Medicaid and Medicare, however, we do anticipate we could see some reversal of this trend and see that number start to climb again. While insurance coverage is improving in the metro, access to health services remains a challenge. Common barriers that were cited by the people that were surveyed included appointment availability, office hours, cost, provider availability, transportation, and language and cultural barriers. And unfortunately, this trend has actually increased significantly since 2011. So you'll see we were sitting at 33.4% back in 2011, and we've actually skyrocketed up to 42.2% in 2024. So even though more adults are finding coverage, they're still having difficulty getting into care here in the metro. And while we aren't able to necessarily create new opportunities for people in specific providers' offices or health systems, we do have a role to play in increasing access here in the metro area. Around 4,000 adults in 2024 sought health services in our DCHD STI clinic. It was just shy of 4,000, and those visits were primarily male, with 60% of our visits being male, predominantly white and mostly young adults. Another way that we have used our clinic services to increase access, especially to testing and treatment, which we know many in our community need, is through our outreach and at-home testing programs. And this really does help us also to engage our community when we are out in the community, and also really trying to make sure that we're meeting our clients where they are. So we do this through community engagement. So we were able to have 254 community events in 2024, and just shy of 5,000 people that were reached through those community events. And we also were able to secure some new education locations, so basically places that we're able to go out and conduct outreach. Some of those additions included the Better Birth Program, Stevens Center, and IB Black Girl. This has been a really popular program. So in that graph there, you're going to see a spike in March of 2024, where we actually had our highest volume. About 37% of our annual volume happened in that month alone. And what had happened is because of program issues and staff shortages, we actually had to limit those services by closing the at-home testing program for a short time, and that spike happened when we opened back up. So you can see that there is a true need for that in our community. We also are continuing to catch up on the number of people who are requesting our at-home testing programs, so this remains a very popular program in our community. We were able to also implement our Douglas County Health Department vending machines in 5 locations, and there are conversations happening to increase the number of these that are in our community, which we're really excited about. These are very highly used, so close to 6,000 health items have been accessed in the short time we've had these vending machines out in the community. The highest number of resources were dispensed at our own vending machine at the Douglas County Health Department, and that's followed closely by the Washington Branch Library as kind of the second place in terms of the highest number of resources that were dispensed. And you can see there some of the top items that were dispensed that our community has the most interest in. And the majority of our users are in younger age groups, so young adults up to age 44, which is moving into the middle age. And so we know that this is something that is really, really needed in our community, and we are excited to see this service in particular expand. And so far we've been able to keep all of these products free, and hopefully we're able to keep it that way for as long as possible, because we know that this is just something that is incredibly needed and necessary in our community. We do collect a few demographics within the use of these machines. So when somebody comes up to access services, there are a few questions, some basic questions that the little kiosk will ask. So we're able to, besides tell you the age group of the people who are using this the most frequently, we know that white individuals represent the largest user group at 44%, followed by our Black community at 22%, and that women actually are the primary users of this at 65%. So that is who is accessing these services throughout our community right now. Continuing to talk about access to services, 833 individuals were reached through our Douglas County Health Department's navigation program. So this is our community health workers that are out in our program through our health promotion program. And they are out in our community doing fantastic work one-on-one with people who need resources every single day. Our community health workers are incredibly hard workers, and they are always ready to rock and roll and get people connected to whatever the resources are that they need. And you can see there on the right that we're able to provide referrals into resources for food, housing, healthy housing, adult education, utilities, healthcare, access to care, helping people get benefits that they need, being able to refer them into legal, and then also dispensing Narcan when needed. Excuse me, I shouldn't say dispensing, distributing Narcan when necessary through those community health workers. And we saw a really great example of what our community health workers do and the beauty of cross-program collaboration within our department this year when one of our disease investigators identified that we had an individual that needed treatment and we were not able to get this individual in to come in to get that treatment. And so the clinic, community health workers, and that disease investigator all came together to locate that individual that needed the treatment. And they were able to not just make sure that that treatment was completed, but they also were able to work to get that client and the family into food, shelter, and other social services that were necessary. So this was just somebody who came in for one particular service, and in the long run, we were able to all work together to get them all of the things that they need to hopefully be healthier going forward. And I was just extremely proud to see how they worked so hard and worked together to make sure that this family was able to access the services that they needed. And just to finish that particular topic, I wanted to share with you this employee recognition nomination that came up in April of this year, and I kind of think that this says it all. So community health workers often go unappreciated. In the midst of chaos, it can be hard to remember those on the front line. These employees have excelled at their job. Day in and day out, they come to work with one thing in mind: how can I help my community? Whether that's working with organizations all over Nebraska to find utility assistance for a community member that is about to have their power turned off, providing pantry boxes to a refugee family who just needs a helping hand, or leading programs like the Diabetes Prevention Program or Project New Lens. These community health workers are exactly what best represent the core values here at Douglas County Health Department. I was fortunate enough to get the experience of working with these individuals and wanted them to get the recognition they deserve. And I thought that was just a really compelling and great example of the work that gets done in the department. Moving on to substance abuse, which was another hot topic in our community health assessment. So our biggest program to date for this is our Overdose Data to Action, which is the OD2A grant, if you remember. And this is limiting overdose through collaborative actions in localities. And really the point of this particular program is to collect accurate, comprehensive, and good data on non-fatal and fatal overdoses, and to enhance our surveillance efforts around that, to monitor drug trends, and then also to come together as a community to find ways to improve linkages to care, to decrease stigma, and to improve harm reduction, and to help our clinicians and our health systems here in the metro know what best practices are around responding to overdose, and then overdose fatality review team. And while we still face some challenges with our OD2A program, we are moving forward really well with reviewing cases. Between 2020 and 24 overall, deaths from overdoses have been decreasing in the area, which is great news. And while overall opioid-related overdose deaths have decreased, overdose deaths in other categories have actually either increased or stay the same. So this is an example of looking for some trends that maybe we need to dig deeper into to understand best so that we can intervene appropriately as a community. So we continue to look for those kinds of trends so we can do a better job. And then of note, we also, as part of this initiative, are distributing naloxone, and we have distributed quite a bit of naloxone through this particular program. So in 2024, through our outreach and clinic, we were able to dispense 461 boxes. And then total in 2025 so far is 704 boxes, and that's through all of the different ways that we distribute that. So you can see there's quite a need for that. People are interested in this. And one thing I also want you to keep in mind that that's boxes, but that's actually 2 doses per box. So sometimes it doesn't work the first time, and an individual may need a second dose, so they usually dispense that with 2 doses per box. So we've actually distributed twice the number of actual doses. Nutrition and weight also was a key area in the community health assessment. And we do know that even across the nation here, and of course here in Omaha as well, we continue to see increasing trends in overweight and obesity. And this is something that has been going on for pretty much my entire career in public health. This has been something that we have been talking about for a really, really long time. Currently, 38% of our metro area adults are obese, and about 70, maybe just a little bit over 70, are considered overweight. So we know that this is obviously quite an issue. And of course, the issue there is that overweight and obesity are risk factors for a number of other chronic diseases that would follow from that. So Douglas County Health Department offers an evidence-based diabetes program called the Diabetes Prevention Program, aptly named there. And this is an evidence-based program that we know has worked in many, many other areas, and our community health workers are the ones who are able to hold this for us. And over the past year, our community health workers were able to hold introductory sessions for languages that we haven't ever offered this in before. So we were able to offer that in Burmese and Karen languages. 17 people actually attended those, so that's actually a pretty good showing for especially a language spoken that is not one that has ever had access to this programming in their own language. And so this launch was, first of all, pretty amazing, and I have to just sing the praises of our community health workers that actually were the ones who translated all of this material, but also worked collaboratively with UNMC Office of Community Engagement to make that happen. And then our Douglas County Health Department community health workers also offered the Diabetes Prevention Program introductory session, at the Juan Diego Center for our Spanish-speaking participants, and they had 6 individuals attend there. From there, they're able to find out who's actually interested and enroll them in the program and hold the full program from there. And just kind of a note about this particular program and its importance in the community, besides the fact that we get interest and we get people actually attending. A local grocery store encounter with just a member of the community highlighted the program's reach, where a woman shared with one of our community health workers that she had actually lost 20 pounds by following the diabetes prevention program. That she had actually been able to attend previously, and really expressed her appreciation and excitement that that program is happening here in Omaha because she found so much benefit from the information and resources that were provided through that program. Of course, we want to continue to expand our focus on nutrition and weight, especially as it pertains to a number of issues out in the community in terms of obesity, overweight, and really making sure that people are able to access the things that they need to decrease their risk factors. Unfortunately, 24% of metro area adults in 2024 report having difficulty buying affordable fresh produce, and that trend has gone up significantly. So it looks like things got a little bit better for a while. Between 2011 and 2015, we were able to decrease the number of people who were struggling to buy fresh produce down to 16.1% at the lowest. Unfortunately, that trend has reversed and has gone back up to 23.7%. So we see more and more individuals here in the metro that are struggling to find affordable fresh produce. And so that is something that we definitely want to, as a community, try to engage and reverse. We were able to partner along with Sarpy-Cass Health Department and Pottawatomie County Health Department over in Iowa to administer the Nutrition Environment Measures Survey, which looks at basically any stores that offer food or sell food and what kinds of foods they're selling. So we surveyed here in Douglas County 533 stores and evaluated the access and affordability of the 5 health food categories. So these 5 categories are fruits, vegetables, grains, meat, and milk. And so you'll see that 45% of those 533 stores that were surveyed did not have any of those healthy options available in their store. And only 16% had all 5 of those healthy categories. So some work to do there for sure in terms of where we're able to get increases in these healthy foods being offered in our community. From there, we are continuing to work with NEMS surveys. So we are working on our NEMS perception survey, which looks at how health food is actually viewed in the home. So not necessarily is it accessible, as we've already kind of looked at that piece, but looking at who is doing the cooking and who's doing the shopping for those healthy items and what's the perception of those healthy foods in the home. And that data collection is ongoing. We're hoping it will be done next month, and data analysis should be completed sometime this fall. Our WIC program is a huge key player in our ability to address nutrition and weight in our community. So we have a very popular WIC program in several locations. Our redemption percentages for our WIC benefits in 2024, 79.2% redemption rate for fruits and vegetables, and then 36% for whole grains. Our WIC program does some really amazing work in terms of ensuring that we're getting nutrition to women, infants, and children. And part of that includes breastfeeding and encouraging breastfeeding to occur with every new birth. And so in 2023, we actually were able to see that 82% of our participants had breastfed at some point. 38% continued to breastfeed 6 months later, and then 23% at 12 months. So that was pretty good. One issue that we have with all of our programs is that we're doing all of these things that you see on a shoestring. So we don't have always the amount of resources that we truly need to reach everyone who needs these services. And so we continue to look for funding, but we work our hardest to have a big impact with what we do have.
Dr. Hughes?
So that would be that when they get their WIC benefits, they have so much to spend, if you will, on certain types of food, so those healthy categories. So it's a good sign that almost 80% are, in fact, redeeming their fruit and vegetables benefit.
Okay. I was going to wait to the end, but as long as we're asking a few questions on that slide around, that caught my attention on weight and nutrition and stores across the metropolitan area. So 45% of those stores had no healthy offerings, and only 16% had all 5 categories. Are those grocery stores, or is that a combination of convenience stores, or how would you describe what that is?
That's a great question. It is it's different kinds of stores. So yes, there are grocery stores included in there, but there are also quick marts and convenience stores, some of which have expanded their offerings, and you are able to find some fruits and vegetables in some convenience stores now, but certainly here in the metro area, not all of them do.
Okay.
Yeah, it's a good question.
Concerning numbers.
Yes, absolutely. Mental health, of course, has floated to the top of our priorities list for a number of years now. And continues to be an issue here in our metro. So in 2024, we saw the rates of residents experiencing fair or poor mental health increase dramatically. So back in 2018, about 8% answered that they experienced fair or poor mental health on our survey. And unfortunately, in this most recent iteration, 23% reported that. And so we know that this is certainly an issue that we're seeing more of. Hopefully, we're talking about it more, and I'm hoping that that has contributed some to the numbers that people are just, more willing to actually have the conversation around their mental health. And then, interestingly, nobody in the metro that we surveyed said that mental health wasn't a problem. Everybody felt that it was a problem at some level. 90% felt that it was a major problem. About 10% thought it was a major problem. But again, nobody thought it wasn't a problem at all. To address this, Douglas County launched our own mental health campaign called Mind Matters, and this has just been going on for about a month now. It's called Mind Matters, Let's Talk. And this campaign promotes our Credible Mind platform, which is an online platform that is free and anonymous for anyone in our area to utilize. Our soft launch for that happened on May 1st, and our formal launch happened on May 15th. And just as of May 31st, so again, this has not been in the community for very long, 683 new users. 32% of those completed an assessment. And to compare that, when you look at some data from NACCHO, which is the National Association of City and County Health Officials, when they look at this particular platform, about 24% of the customers had completed the assessments. We had 32% that have completed assessments just in this short time that we have had it. So that shows that there is certainly an enthusiasm out there to address this issue. Of those users, predominantly male or female, so 68% female, 32% of those were teenagers, so 13 to 17 years old, 32% of the users, and then about half were over 18. So we know that this is a super popular platform so far, and it seems to be catching on with our young users, which is wonderful news because we know that youth mental health continues to be a major concern here in our metro. We also were able to continuing offering our homegrown project New Lens. We've had 82 participants in 4 sessions, which is really exciting. We've had 4 sessions of this so far. We've had those in summer of 23, that was that initial one, summer of 24, winter and spring of 25, and summer of 25. And so far we've had participants from a number of organizations around town, including North Star Girls Inc., Boys and Girls Club of North and South Omaha, Omaha for Us, Hope Center for Kids, Bluebird Cultural Initiative, and Nebraska Urban Indian Health Coalition. And so we are extremely grateful to those organizations and their partnership to help us to just expose our youth to other ways to take care of their mental health. And here you see some comments from participants in this program. So these would be directly from those kiddos that were able to participate. And these are things that they learned. They learned that art can be used to express emotions. I felt good. Now I'm happy. I learned what to do, that what you do affects others. Skateboarding was wonderful, and I loved it so much. I did the hardest thing on my first try. And I learned how to calm down using music. So this is just a few quick anecdotes about what was learned through this, and hopefully we are able to continue to offer that and help our youth understand that there's more to mental health than just going to a therapist, although we do recommend that too. Moving on to infant health and family planning, which was another one of those areas that was identified as important. The problem that we are having here in Douglas County, I think, is pretty well known. Infant mortality, which is death of an infant before their first birthday, continues to be an issue here, and the disparities especially are what continues to be a major issue here. So we are aware that our Black babies die at 3 times the rate that white babies do, and we don't want any of our babies to die. So this means we have work to do in identifying why this might be happening, why the disparities exist, and really finding ways to fill gaps and help to contribute to a much lower infant mortality rate here in the metro. Of those infants that were lost, 88.2% were born at low birth weight, and that can be an indicator of a lot of health issues that can be present for those babies. And then 5.1% of those babies that passed away, in those cases, there was no prenatal care in the first 6 months of pregnancy. So we know that healthy mamas have healthy babies, and we also know that good prenatal care means being able to identify issues early that people are able, the providers, the healthcare system is able to hopefully act on. And so those are a couple of things that have been identified, but as we are able to really work with the community more on this, hopefully we'll be able to find ways to address all of these. So Fetal Infant Mortality Review Team was really reinstated and kind of reinvigorated in the past year, and we're really proud of these efforts. So FEMR is the Fetal and Infant Mortality Review, and it's a community-based process that looks at those fetal and infant deaths to better understand all of the factors that were involved in that death. So it's not just looking at the clinical picture, but also looking at the social variables that might have been present or other systemic issues that may have been present and contributing to that death, and then we're looking for trends. So the purpose is to identify those factors, to address health disparities and any gaps in the system, to improve health for our babies and our moms, and also to improve the care that they receive, to collaborate across our entire community, because Douglas County Health Department can't save every baby, but if we work together as a team across our community, perhaps we can save most of them and then prevent those future losses from happening. Again, we were able to revitalize this. We were able to hire a FEMR nurse, and she has been absolutely fantastic. I believe you'll actually be hearing from her in the next couple of months here at Board of Health. So I tried not to put too much detail in here because I don't want to steal her thunder. But we were able to hire that nurse, transition our program into a different division, and be able to really establish a team around FEMR instead of just one individual. We were able to bring in the National Center for Fatality Review and to really start doing some great strategic planning around this program and build a sustainable way forward. For our case review team, we have already been able to hold 5 case review team meetings attended by about 45 different people, including those with lived experience. So that was something really important that we have on that team. Again, we've reviewed 5 cases and we've completed 7 maternal interviews. I want to just take a quick minute to explain why that is a big deal. It can be very difficult to get families to have a conversation about their loss, very understandably. We like to do these types of interviews because oftentimes we're able to get much richer context around what happened in those cases. Our FEMR team is fantastic and incredibly compassionate when they're working with these families, and we have been able to already do 7 of those maternal interviews. And I understand that if you talk to the national FEMR folks, that's pretty astounding that we have been able to really, in our first big push since we reinvigorated this program, been able to get that many. And we are very, very close to our goal of 10, and it's only June. So that's pretty great that we're able to do that. And we'll hopefully continue to be able to get that rich information that helps us. We are also able to host 2 community action team meetings. So the community action team is what you would have known as Baby Blossoms. And we are not just meeting, but actively planning for the future of that effort as well. We did want to share with you just really how important this program is, and we did get permission from the family to share this quote with you. Thank you so much for your support through everything. During the interview process, it was very easy to open up and share our story of our baby. You were comforting, warm, and very understanding of the emotions we were feeling. My husband and I enjoyed the time we had together. It was healing to tell our story and hope our experience can support others in the community that may experienced stillbirth. I really love that Douglas County Health Department reached out to us to see what support was helpful and what support could have assisted us last year. Yesterday, we went in for our genetic counseling appointment and with the high-risk doctor. You helped us set these appointments up. We found out we are 5.5 weeks pregnant, and we're absolutely thrilled and in complete shock. Lastly, thank you for all the resources you shared and helping us through the tax process as well. And so losing an infant through stillbirth or otherwise can be incredibly traumatic, and I'm filled with pride that we are able to offer support to these families. All right, social determinants of health. This is kind of a big, broad category, so I'm just going to give you a very brief overview of what this looks like in Douglas County, because we're actually doing quite a bit of work here, and I want to make sure that we're highlighting that. So the social determinants of health are really those conditions in which we are born, we live, we learn, we work, we play, all of those things. And some of the examples are safe housing, safe neighborhoods, education, employment opportunities, access to nutrition, which we've talked about quite a bit, environmental factors, and so on. And of course, addressing these social factors helps us to build the foundation for people to make healthy choices and live healthy lives. So here in Douglas County, just a quick a reminder, since you saw this data last month, but housing insecurities have increased over the past year. So in the past year, we've seen that 33% of people have been, at least at some point, worried about paying their rent or mortgage. 13% report living in unhealthy or unsafe conditions, and then 10% went without electricity, water, or heating. And we had increases in that worry over paying the rent and mortgage and living in unhealthy or unsafe living conditions. We also have seen food insecurity increase, which we've talked about just a little bit, but this is a pretty compelling graph here where you see that the metro area residents who reported food insecurity. So this is beyond just access to healthy fruits and vegetables. This is being able to buy food, period. And so we see that in 2024, unfortunately, more and more of our residents are struggling to access food. One good note is that here in the metro, we seem to be increasing our education status. So we have more and more individuals who are attaining their high school diploma. So that's great. Back in 2021, 8.8% of individuals did not have a high school diploma, and that's down to 7.7% in this most recent iteration. So we have more people graduating high school, which is great from a social determinant standpoint. This is a very busy slide, and I apologize for that, but I wanted to make sure that we are just highlighting that Douglas County Health Department does a lot of work around these social determinants of health, besides the fact that we have community health workers out there that are actively trying to connect people to resources. We have addressed language access in healthcare through systems that we're able to use to get interpreters. So we've been able to get interpretation for 35 unique languages over the past year, and well over 600 hours of interpretation just this year between January and May. We were able to establish a language alert network, and this is really to make sure that emergency information, public health information, and safety information is disseminated to populations that perhaps have different languages that are spoken, such as refugee, immigrant, and migrant communities, and then they're able to take it and translate that or interpret that into the format that's necessary so that people can actually get the emergency information that they need. We continue, of course, community engagement around FEMR. We're doing policy scans in a number of areas. We talked about the overdose prevention, of course, mental health. We talked about WIC. I did want to mention that they serve over 14,000 participants per month. So that's not per year, that's per month. And then our environmental health program is integral in assuring safety here in our community, which is one of our social determinants 4,200 food inspections, more than 16,000 children screened for lead in the past year, and hundreds of sanitation inspections and pool inspections that have been conducted just recently. And then our epidemiology department protects health and safety. Last year, they did 3,000 disease investigations and responded to 75 different outbreaks, and you heard about the big ones there. And they continue to be just incredibly important sentinels in our community to protect us from the threat of disease that's out there. And then we talked a bit about our health promotion teams being out there across our community as well. This is just a cross-section of what we do. We are working hard to really look at those foundational pieces that help people live healthier lives. And so hopefully, as we're able to move forward as an ever-strengthening department, we're able to see those trends that we've talked about previously in this presentation. We'll be able to see some of those trends hopefully reverse. So I wanted to talk to you a little bit now about what's happening internally at Douglas County Health Department, and you did get to hear our strategic plan presentation, and so some of this will be a bit of a reminder, but I did want to talk a little bit about what's actually happening in real time. So, and just a very quick reminder, this is kind of that bottom part of that model we looked at, really looking at those foundational pieces that help us make all of the other work happen well. So in our strategic plan, we identified that data-driven solutions were something that were very important to everyone in our department. So ensuring that we are using evidence-based public health practice to promote operational effectiveness and maximize what we're able to really do in our community. And through that, we're hoping to build trust through transparent and visual data-driven decision-making, really enhance the way we're able to make connections between just numbers and what's actually happening and the human impact there through storytelling, and utilizing technology to be better at what we do. Just a couple notes on that. So in terms of increasing transparency of our data and being data-driven in the data that we are putting out, we were able to add to our data portal. So there's a link here, which this presentation will be posted later. You're welcome to visit that, but this will be what you would have known as the COVID dashboard. And now the COVID dashboard is its own thing alongside an RSV dashboard and an influenza dashboard. And we have a pertussis one in there because we had a pertussis outbreak this year, and it was important to us that the community was able to see the data in as real time as possible. We also have STI data on there. We also have ArcGIS data for our food safety inspections and air quality, and just really a number of different dashboards that are now available in the portal for you. And our hope is to continue to expand that so that people in our community can see the data with which we are making our decisions as the health department. We are actively training our data analysts in ArcGIS Insights so that we're able to do this in a timely and effective way. And we will also be starting to build out storyboards in those data portals and dashboards to better translate that data and enhance that decision making. We're also trying to not be so siloed when it comes to data, so really starting to work together and across programs on our data collaborations. We were able to implement an interdisciplinary DCHD data work group, and they were responsible for part of this presentation today. So I am very grateful to them for that. And we also, this past year, were able to expand our Regional Health Council, which is the entity that really heads the community health assessment and community health improvement plan process to really improve the ability to share data and to engage the community around the data that's used for really assessing and planning for our whole community. Community engagement was another area that we identified as being very, very important to Douglas County Health Department. And part of that is we want to improve our visibility and make sure that people know that we're here for them and to serve them. And we also want to improve our collaborations so that we can help have a better impact in our community. For instance, improved collaborations can really help us to synergize with our resources and with our ideas to really become stronger Just an example, and this is not one that is currently in place, but I'd love to see it happen, would be if we were able to, let's say, partner with the City of Omaha, MAPPA, maybe area schools, to help us find innovative ways to help the community feel safer walking in our community. So making our community safer for walking, which would have impacts on physical activity, mental health, transportation, and access, and even education. And so we really, really value those collaborations, and we want to strengthen them so that we're able to do some really innovative work like that. So far, we have an estimated 115 partnerships and collaborations across the community. And again, this is probably, this is just an estimate. We weren't able to capture every single one, so this is likely an underrepresentation of what we're doing out there. Just a quick note about communications. This is an area we've really been able to beef up in the past few months even. We were able to hire a new communications supervisor. So now we have more than one person doing our communications, which is wonderful. We've really had a focus on increasing how and improving how we use social media. So you can see that even just in the past 5 or 6 months, we've really been able to increase our reach in terms of our social media. This is something that we didn't have the ability to really hammer home on, and now we are. And it's been amazing how quickly we've gotten a lot of engagement with kind of our new and improved social media. These are just a few examples of some of the posts. So you can see they're visually compelling. They've got great information. We're providing, mental health information, emergent outbreak information, making sure people know what services are available to them, and then even a great picture of one of our teams. This is our emergency response team, Caleb and Jack, out manning one of our tables at the Storm Chasers. So we were able to work together with Sarpy Cast to have some promotional materials at the Storm Chasers at a number of games. So this was first responder night. They were able to be out there to connect with the community, be visible, share resources, things like that. So pretty exciting things that we're able to start doing in the community engagement sphere. We also are very focused on building a vibrant and healthy work culture and making sure that we are able to nurture that culture so that people feel safe, trusted, that it strengthens their well-being and our organization's overall well-being, and ensuring that everyone feels valued. And so we're really focused on building that culture of trust where people can share their ideas, providing for more professional development growth, and enhancing that culture to make sure that we are acting fairly. Coming soon in this area is the Public Health Wins Survey. I desperately wanted to include data from that in this presentation. Unfortunately, the de Beaumont Foundation did not have that coming out to us until mid-July, and I didn't want to push this off any longer. So we will be getting that in the next month. We will make sure that you get information regarding those results, and we will be using that to update our workforce development plan. We also are building program training libraries, and that's a really big deal because it enables people who normally can't work from home to work from home when we have things like severe weather events where people are asked to work from home, or if, like the other day when we had a water leak, we had to close the department and send people home. So this really enables us to continue to be productive and effective in our work while also providing some flexibility for our staff. And then we've got new onboarding and offboarding checklists, and we're really making an effort to engage all of our staff in our department. So we had our contest to name our conference room. We've started using feedback surveys for a variety of things, and then increasing volunteer opportunities across the department. Funding has been a pretty hot topic for Douglas County Health Department over the past year, especially in the last 6 or so months. And as you know, we've had multiple cuts to public health, and you can see some of that over on the left side of the presentation. Those cuts have come at both the state and federal level, and it's possible more are coming. We just don't know at this point. We have been extraordinarily lucky because we have avoided any reductions in force or layoffs at this point. Unfortunately, that is happening in many, many health departments across Nebraska and across the nation. So we have been extraordinarily lucky in this area. Part of that is being very conscientious with our resources. Part of it is being a large enough community that it opens up new grant opportunities for us that others may not be eligible for based on their size. But we've also just tried to be very mindful about absorbing some of our resource constraints and not, prioritizing keeping our staff employed is very, very important. And so trying to find creative ways to absorb some of those cuts when they come. We've also been diligent about seeking out new funding where we can. So in 2025, we've been able to garner funds from both private and government sources to continue our work. So you'll see those numbers there. Part of that conversation is the establishment of a health department foundation, and I want to assure you that that is ongoing and something that we are actively working on. This will provide an unrestricted funding source to help cover gaps and special program needs for the health department. This has actually been on our strategic plan for the last 2 iterations. And again, we are moving forward, which is wonderful news. We've identified legal representation that specializes in the foundation process and currently are awaiting a letter of engagement from that office. And then in the next 90 days, we're hoping to identify 3 individuals to serve on our initial board of directors, name the foundation, and complete the articles of incorporation. And my understanding is once you can complete those articles of incorporation, it kind of goes into the big black hole where different government pieces have to look at that and give you approval. And so once we get that moving, hopefully we're able to then move into some of the board work in terms of writing bylaws and things like that. Improved workspaces is something that is really mandatory for us to be able to do our work well. So our goal here is to provide a space for meaningful community engagement and also to utilize our workspaces to improve our workflows, to accommodate our employee needs, and for it to be safe, effective, and frankly, comfortable, because obviously, if you have a miserable work environment, it's very hard to be effective in your job. So far, we have revised and re-implemented our work from home policy to provide some flexibility for our staff and to enhance productivity there. And then we were able to renovate our conference room to improve capacity and functionality. Those of you who were able to attend the emergency Board of Health meeting last week were able to see our new conference room. It's also pictured here. We have been able to hold FEMUR case review team meetings, which is really exciting. And then we are also, starting last month, able to hold our all-staff meetings here in person, face-to-face, up to 80 people. We also want to improve our policies and procedures. This was something that we heard loud and clear from our employees. We also know that our policies and procedures keep us on track with being very efficient with what we're doing. So far, we've stood up a policy committee of 15 individuals. We have representation from all of our divisions there, and they meet pretty frequently. And then they were able to draft a policy writing and review process, which we approved in April. We've got all of our policies in one place, and so far, in just the few months that they've been working, they've been able to start getting some of those policies reviewed, and they've got about 5% of those done. And then coming soon, I'm so excited about this. You'll hear about this probably closer to the end of the year, but our performance management system rollout is on its way. So from July to December, we're going to be taking all of the information from the CHA. We're going to be looking at our strategic plan and really writing out those department level goals and really what things that we want to achieve in the next year, 2 years, 3 years. And then from there, we're able to develop those division, program, and individual goals. I really had hoped to have them done in time for this, but my timelines tend to be a little bit aggressive. And so relaxing that and making sure that people can work through the things that need to be worked through first is very important. So we're not quite there yet, but over the next 6 months or so. Part of that is that we are rolling out a new performance management software that's very intuitive, it's easy to use, and will help our leadership to track all of these goals and progress towards goals in a very effective way, and it will be easy for us to be able to stand up in front of you and show you that progress. And then HealthStat is a process that's coming next year. by which programs are able to share with us their goals and the progress that they're making toward those goals in an environment where leadership and others may be present, and then we can really just talk about what resources they need in order to achieve their goals, or if they need to pivot a little bit and go in a different direction, how we can assist in doing things like that. But it'll be a great way for us to have visibility on the work that's happening in the department towards those goals. So there's a lot going on in the community, and we have some really big goals for the next couple of decades. We really, really want to make sure that Omaha is the healthiest Midwest metro by 2040, and I think we can get there. It is a very ambitious goal, but we are well on our way, and there are a lot of things happening in our community that give me reason to believe that we will get there. And with that, I am happy to take any questions you may have.
I have some comments and questions.
Great.
I want to thank you for presenting. In particular, I want to express some gratitude to the staff at the health department for all the hard work they've been doing with respect to the programming, the outreach. I know it's not easy work, particularly because I'm also in that line of work, so I appreciate that. I was disappointed to not see as much as I thought I would see for a state of public health report. A lot of what was presented by, I believe, Jamin with the strategic plan, and then you last month with the community health needs assessment. When I think of a state of public health report, I typically like to see national data, maybe some more local data that was sprinkled in a little bit from the needs health assessment, excuse me. But I just didn't see what I was expecting to see in understanding how our county is doing in comparison to others, in comparison to the state. Where are we nationally speaking in terms of the public health issues that we should be addressing here in the county? I know I came in a few minutes late, so I don't know if you discussed what the top public health issues were and then taking a deep dive into those. I just thought I was going to see a little bit more of that and not what was already presented by you last month with the community health assessment report. So that was a little disappointing. I did see that you presented some data on obesity, specifically nutrition and weight. And Mr. Councilman Festerson brought some of those questions up, which was good to hear, specifically around the access to healthy foods. What I didn't see pulled out of the NIMS was affordability of that food and how, even though it's not accessible, is it affordable? And so that was a missed opportunity, I feel, for what was presented. I also would have liked to seen a little bit more of comparison with the residents. You gave a lot of self-report from the community health assessment, but how does that compare to data about what's happening in the area? What's being done was clearly presented specifically by the health department staff and leadership there. But again, it's not clear what the impact is of what's being done. It's not clear what the actual issues are based on the data and how the data is driving our decision making. Yes, our residents can definitely self-report about how they feel, and we definitely want to hear that. But we also need to hear how that compares to what the data is saying. If they're saying this is an issue, is the data also saying that? And then how do we pinpoint that as being our goals for the upcoming year or whatever the plan is? So that to me, again, was a missed opportunity, because that's usually what a state of public health report would provide us with. The strategic planning stuff, I'm not sure why that was included in the state of public health report, given the fact that we should be focusing in on the data to help drive our decision making. And I just didn't see a lot of that today. And I'm just curious as to why that was the case.
I appreciate that feedback and the questions along with that. So what we have heard in general about the public health or the state of public health report over years is that especially in a year when we just had a community health assessment that provides a lot of that data already, it felt a little bit reiterative to sit down and rehash basically the community health assessment where a lot of those comparisons and a lot of that data is already present. What we did want to make sure happen is that our employees and our community sees how public health is actually tying into those metrics and what kinds of things are happening to drive, hopefully, improvements in those metrics. Keeping in mind that the data that was presented today, a lot of that was 2024 data. So we're not going to see the impact from what we're doing at this moment for a little bit of time. And hopefully, as we're moving into a better performance management setup, which again, that's happening over the next 6 months, is you're going to be able to see more of the short-term and intermediate goals and metrics that will show us that we are going in the right direction to move those. Because some of those things we're not going to see movement on for maybe 5-10 years. It takes time to impact some of these big pieces in our community. And so the strategic plan, again, what we're doing within our department is absolutely integral to making all of that programmatic work happen. We have to make sure that we are able to provide safe and effective places to work. We have to assure that we're appropriately funding our department and foundationally strong there so that we have people who can be out connecting people to resources. We can be out conducting those NEM surveys. And so to me, a state of public health, yes, addresses some of those key issues in the community. And again, we picked the top 6 that were pulled out of the community health assessment because that's what the community told us fit is most important. And we feel that their voice is incredibly important in that. You will see as we go in a year from now, you're going to have more of those, we will do X number of things by Y date and be able to see some of those short and intermediate goals and the progress towards those. And then in 3 years, when we redo our community health assessment, as we do every 3 years, hopefully we're able to see some changes in those things that we're looking at, those, especially those top 6 areas that were identified by our community as the most concerning for them.
Thank you. So impact can be measured given that the health assessment is done, like you said, every 3 years, correct? Mm-hmm. So if 2024 was done, there was one done in 2021. So over time, there is a capability of seeing the impact. Yes, we were doing a health assessment in 2024, but we're doing this work for years now. So there should be some indication of impact over this time. So that's where I'm saying I didn't see that today.
Understood.
And so I'm not finished. Thank you. And so what I'm hoping in the future that we take a little bit more care and concern is making sure that, yes, we highlight what the community is saying. That is absolutely important. But it's also important to make sure that there's data that also supports what the community is saying with respect to some national data, with respect to some state data coming into the county. Like, this is typically how we see data over time. And in past state of public health reports, absolutely we have seen community, or have heard, I guess, or reported that communities' thoughts and their priorities have always been presented. So it's not like that isn't in previous reports. But the problem here today, to me, is that it's been a heavy emphasis on the self-report, and it hasn't been enough of what do we know about the data about our county, about our state. How do we compare to other counties? How do we compare to other states? That's what I think is important for us to know so that we can make data-driven decisions about what's happening with public health in our county. And like I said, I'm not taking anything away from our community and what they've reported. I commend our health department staff and leadership for doing the work because it's not easy. But again, I did not see today in your report what's the state of public health. I saw a repeat of the community health assessment report that you presented last month, and I saw a repeat of what Jamin presented the previous month about the strategic planning, and then some new things sprinkled in. But overall, it to me was not a state of public health report.
Thanks for that feedback. Appreciate it.
Go ahead.
Not really a question, just an observation that yesterday the Omaha City Council did approve, consistent with LB 840, a poverty elimination plan for our community and metropolitan area to work on. And not surprisingly, there's a lot of crossover in that plan's observations with your presentation today, particularly around the social determinants of health, when we have food insecurity and home and rental insecurity and educational challenges that we know need to be part of that solution. So we look forward to working with the Department of Health and many other partners on that plan as we go to implement it over the next several years. And then just an editorial, if I may. The congressional debate right now over funding cuts to public health and then to things like early childhood and affordable housing and SNAP benefits and Medicaid are not helpful to that effort. So hopefully those opinions will change in coming weeks, and we look forward to helping to work on all those issues together and address the economic disparities we know exist in our community.
Thank you. And I had the pleasure of also reading the report that came out yesterday and read through the health and well-being portion of it, and really hoped that we would be able to partner more with the city on those efforts in the future. It was a very interesting report, and I think has some incredibly wonderful, lofty goals, but also very important to the health and overall decreasing poverty. We know is one of the most important things that we can do to build a healthy environment for people to live and grow in. So I appreciate that, and also look forward to partnering with the city and other organizations in the community.
Thanks, Council Festerman, for that. I think that just goes to show the importance of having a state of public health report that really determines the magnitude of the issue, because we really don't know what the magnitude of the issue. We know poverty is an issue. We know that these things are an issue, but we don't know the magnitude.
Dr. Hughes, walk me through. So I missed last year's because I was out of town. So I feel like I'm trying to get the context. So walk me through where your thought was with this, because I was trying to get an understanding of like what you would grade the grade of public health in the county at this point. So if you just walk me through a little bit where you were trying to go with this. Are you trying to convert it somewhere? Like next year when it's not a community health needs assessment year, is there going to be a difference? Did it change a little bit because this is a year where it comes together? I guess walk me through where you're trying to get with that.
Thanks. Good question. So yes, that's exactly right. So we had kind of a convergence of a lot of different assessments that came together this year. And if we are doing our due diligence and making good decisions and evidence-based decisions, we're using a variety of data from different sources. So we're not only informed by our community health assessment. There are so many different pieces that can come into play. The community health assessment, of course, is a huge piece that helps us really understand the data around a variety of different health indicators, which I feel we covered when we did talk about the CHA and present that data. You know, these top things that floated to the top were really kind of our that, along with our strategic plan happening this year, and later on in this year, Public Health Wins. Kind of all these different assessments give us an opportunity to talk about here's where we are right now. This is the trailhead we're standing at right here. This is kind of what the environment looks like right now. Next year, we'll be able to say, here's the progress that we have made. Here are a number of data points that show you, what's happened on the trail so far and what part of the trail we're at now, and what the health of the community looks like now, even though this isn't, we're not going to have the same level of data next year in basically year 3 that we have in the years that we do those community health assessments. We'll have a little bit through health indicator data that, we're able to pull on an annual basis, but it won't be this, okay, we've got all of this stuff now that we have to look at and really determine a way forward. And part of the confusion that I have heard in the past is not really understanding how the community health assessment and the state of public health and strategic planning and all of these pieces all work together. And so this year was really looking at how do we pull all of these pieces together to look at what is the health of not just the health department or not just, the community, but also the health department, and how is that going to inform our goals going forward. And then you're going to see more of those measurements or, numbers, I guess you can say, for year 2, year 3, and then we'll have another assessment year where we're able to kind of bring things together again.
So are you describing this as kind of a pivot year?
A what?
Are you describing this as a pivot year for the report to some degree, to pivot to a?
To an extent, I think that you'll probably, to Dr. King's point, you're probably going to see more of those numbers. You're going to see more numbers about what kinds of things were done in years 2 and so in 26 and 27, and then we're going to have another iteration of the community health assessment. So then we're going to have a large data set again. So this is really trying to put it on a more understandable and more cohesive, just making it more cohesive for better understanding of how all of these pieces fit together in our decision making.
Okay, so how would we rate, I'm just curious, how would you all as a staff rate where public health is from a year ago to today?
From a year ago to today, I don't know that public health has. It's hard to say that because things, I would say, have still been normalizing somewhat, having come out of the pandemic, and then we had kind of a really big administration change that is changing how public health looks again. I would say that the health of the community hasn't probably changed significantly in the past year. However, 1 year in public health is not that long. So it's a little bit hard to say we are vastly healthier today than we were 365 days ago. If you look at where our community is, say, compared to 5 years ago, again, that's pretty hard to say because that was the beginning of COVID. And so there were some pretty, I don't even know if our measurement and data collection was where it needed to be 5 years ago because so much of public health had to pivot to address that public health emergency. But you saw in there, we've had increases in difficulties affording homes. We've had difficulties in the ability to afford fresh fruits and vegetables. It's harder for people to buy healthy foods. We know diabetes has been basically unchanged for decades. We continue to see high rates of overweight and obesity. So has our health changed much over the past year? I would say it probably hasn't changed much in the past year. We're probably pretty close to where we were last year. And again, part of that is that we had 3.5 really tough years where we were very focused on a singular issue and, kind of normalizing coming out of that. We've had changes in funding, changes in, priorities. And so having gone through that normalization process coming out of that over the past year or so, I don't know that that's enough time to really say, we've been able to shift back to our normal tracks or to looking at health in a more broad way in the community again versus looking really, really hard and all the time at COVID. And have we made difference in a year? It's really hard to say that. I would say, if I had to give us an overall grade, I'm not a huge fan of giving an overall grade like that, but I would say we're probably a B, B minus, and we definitely have work to do to really work, I think, on especially those determinants of health that are making it so hard for people to go to the doctor, to undertake healthy behaviors, to live a healthy life, to just, be able to make the day-to-day choices that lead to better health.
Okay. And that's what I'm asking is, do you see this as a because I'm trying to see if this is the transition to some degree of where you're trying to, I saw all the strategic stuff in there. I'm trying to ask, that's why I'm asking you is, do you see this as a pivot point? Because right now, if I was to say it, I mean, the atmosphere is, I mean, people would think public health and a whole lot of other stuff is under threat. So that's why I'm kind of asking, is this a pivot point where, say, okay, you got the first year of this, of the administration, you're gonna have the reconciliation package, and to what the councilman noted, we'll see what happens at the end of the month, how Medicaid and other things reshape it. How I'm wondering is this a reset and where you're going with it? Because what my hope is that I see where you're going with the data, but I would like to see a little, I want to see a status of public health to kind of frame it up.
Yes.
And that's what I mean, because I do think if we got a status number of public health, that helps frame some of this argument. What my hope is that public health helps frame the argument for the poverty plan. Now, their discussion yesterday was a whole nother element of funding and things, but I do think we're gonna have to braid our way through this, because I think that the kind of sentiment yesterday was that the city was gonna fund all this. That's not possible, but I just wanna make sure that we know how it's gonna work together. So I had this wasn't what I used to see in framing, but I can bear, because I want to see how the pivot goes, because I see there's a lot of things working in there, and right now in itself, the whole, every public health, everything is under threat right now till we get an idea what the ground under us is going to be after the reconciliation package.
Right.
But no, okay, I'll see where it goes.
Well, and to your point there, learning to tell our story and to explain maybe in a more robust way how we're working in our communities is a focus across public health right now, because we've put data out a lot over many, many years, and we're in a position now where we're watching our funding under threat on a daily basis, something new every day. And so,
Okay.
yeah.
No, I'll see. I'll watch and see how it develops. I see.
Yeah, I got a couple other comments.
Come on.
So I hear you with the different data pieces and trying to bring those together. Again, I still only saw the community health assessment today, but you mentioned there were other data pieces and all these things. And again, if this is supposed to be the opportunity to bring them all together, we missed the mark today. And if we're talking about funding and the threats to public health, to President Rogers' point, we need to make sure that we're doing things to ensure that we are prepared in the event that that happens, which brings up the point of what you brought up in your presentation today around the foundation, which we've been hearing about, I want to say, for the last 2 years, maybe longer, I'm not sure, but it's been an ongoing conversation, particularly since you stepped into your role. But I haven't seen any movement on that, and I think if we're talking about the funding being at threat, like, we need to be moving on establishing this foundation and getting it going, especially when there are donors and people that are interested in pouring into that funding. And so we've been hearing about this board being set up for probably a year at least, because I'm paying attention specifically to this foundation being built up. And these articles and whatnot. So what is the actual timeline for this to be set up? Because it's been 2 years and we still have not we haven't set it up. We don't have a board. We don't have these things happening, or maybe they are. I don't understand. But what is the timeline for that so that we can be more proactive about making sure that we're seeking funding in the event that these other mechanisms are no longer an opportunity for us to get funding from?
So, good question. I did lay out in today what will be completed in the next 90 days, so hopefully that's helpful. It is quite a process. This is not as simple as, deciding I'm going to stand up a foundation and slapping a name on it and, going forward. There is quite a process, and when you're doing it as part of a governmental agency, there are a lot of pieces that you have to make sure that you're doing it correctly. And so we had talked to an attorney. That attorney ended up leaving, and so had to find a new person to cover that work. I've had several conversations with her even in the past couple of weeks, and it's more complex than people probably realize it is. And so right now, I'm again waiting for that letter of engagement, which basically just says, yes, we're going to serve as your attorney and you'll pay us. And that person is going to be the one who's walking us through, making sure that all of those pieces that have to be correct are correct, and that as we do this it's a little different, I think, if you were an individual off the street who were standing up a foundation. But when you're doing this attached to a government agency, there are a lot of pieces that have to be correct and be done right to avoid, conflicts of interest and things like that. So the process is absolutely moving. Again, hoping to have those articles of incorporation, which is really just paperwork that has to be done and completed before it goes to the state and to the federal government, to the IRS for their process.
Understood. So is there a date, a goal of when you want to have this foundation set up? I feel like this should be a priority of yours as the health director to really get this.
Thank you.
Off
It
the
is.
ground.
It is. So by the end of the year is the goal that I have set. But again, a lot of that depends on the processes that are inherent in that process. I can't make the state of Nebraska or the IRS move faster than they do. So I don't know. I mean, it could be a very fast turnaround. It could take a while. So it depends on those pieces. My timeline, I would love to have it finished by the end of the year. It is part of our strategic plan. I also want to state that it was part of the previous strategic plan that I was not here for, and nothing was done with it at that time.
Yeah, we know we were in COVID at that time too, so that obviously makes sense for that.
Absolutely. And so we are moving forward on this. It's just not something that's going to happen overnight, unfortunately, because there are a lot of steps involved in order to do it correctly.
Okay. Is it possible to get regular updates at our Board of Health meetings moving forward until the end of the year, since that is your goal, to have it set up so we can kind of understand how it's moving along in the process? Because if you're saying it's this complicated and there's a lot of paperwork that needs to be shuffled around, then I think it would be nice if the board would be able to be in the know monthly about your progress towards your goal of having this set up by the end of the year. So that way we could give you some insights or guidance if it's necessary as you move forward. But I think if that's your goal, I'd like to see it happen by the end of the year if possible.
I certainly could do that. As part of the strategic plan, you'll be getting quarterly updates on all of the priorities under the strategic plan. If you want more frequent on that one, I'm happy to do that. But just so you know, you would be getting updates already.
Yeah, quarterly seems pretty long for something like this that tends to be more time sensitive, given, like I said, the restrictions of funding that's happening both at the state and federal levels. So,
thank you.
A couple questions. First of all, thank you for your presentation. Thank you to the entire health department for all you do. I echo that again. So thank you very much. Back to the FEMA. I don't want to bring this back down. And on that, I know you said the presentation's coming up since we have Carol replaced. Carol, right, was previous?
I think a couple of nurses ago, yes.
Yeah, a couple ago, so keeping track. With the importance, with the drop of birth rate, fetal infant mortality rate, it becomes even more important. I couldn't help but notice on the slide, I think Caucasians were at 5.9, Africans, blacks were at
11 point
11.1.
something, yeah.
And then Hispanic was at 4.0. And I think that's been a downtrend over the years, if I remember correctly. And so I'd like to see a couple things for this presentation. One would be our overall birth rate, like what's the ratio of the climate, because it's such a small number that one or two births can swing stuff one way or the other,
Sure.
especially if our birth rate's coming down. But I don't think in our county, I think it's still an upward trend. But I want to make sure that we're looking at where the differences are in those groups. I mean, if we can lob off that 11 and get it closer to 5, it's going to bring us to our goal, which
Yeah, absolutely.
is 5.
Yep.
And so that's something I'd like maybe us to look at and it's hard because we're looking at the deaths, we're not looking at the the lives. We're not
Right.
looking at the bursts and what's working, but within those groups, and then again, the getting them to testify or say, do the interviews, it's really, not testify, interview, is really tough. And so then you end up with an even smaller number of
Right,
data sets on what's being missed.
right.
So I'd like to see that. And then my final question, viability, what are you doing 24 weeks, counting it as a fetal death, or what? Because where's our cutoff? Like if they have a stillbirth at 6 weeks, so I'm sure we're not, is it 24?
It's 24,
Okay.
24 weeks.
That's what I assumed it was, so, okay.
Yeah.
All right, that was it then.
All right, thank you.
All right, thank you very much.
Transfer into director's report.
I don't have a whole lot for you for the director's report. I think you heard quite a bit today. I know legislative report is in there, and happy to report that the legislative session has ended. We did end the session at a $3.5 million cut across public health in Nebraska. The impact to us is a little over $500,000, and again, that is to general fund, state general funds that we get. That does not include the healthcare cash fund, which is a separate pot. That money was not touched. So we were able to basically end the session a little bit better than what we had started it with, or what we thought we might be getting. So that was good news. And then we do anticipate that there probably will be more conversation over the summer and moving into the short session in 2026 about funding as well. So we don't think that we're completely in the clear there just because the legislative session has ended. We anticipate those conversations to be ongoing for a while.
Do you you think they're just going to leave alone the veto mistake, or are they going to try to get it back through something else?
No, I think they're going to, well, for now, I think that the veto issue is dead. I think that next year, probably that $1 million that was intended in the veto that didn't go through will probably come up again in January.
Okay.
I have a question.
Go for it.
Have all the folks that worked on the CHA, the organizations, have they all been paid?
We don't typically pay so when you say the organizations, are you talking about the ones that come together as the community, as the regional health council to administer? They're not paid. They pay to have the community health assessment done. The Wellbeing Partners facilitates that process, and they do get a certain amount that is contracted for basically their facilitation.
And have they been paid?
Yes, I think our invoice for that is in process right now, actually.
Okay. It's been brought to my attention that their invoice has been well over 6 months past due. And I guess that's concerning for me, and hearing it from multiple sources that this has been a challenge to get them paid for whatever reasons. I'm not sure what those reasons are, but I wanted to ask you today why that was that far overdue, given that we've been done with the CHA for since the end of last year, and still just now being in process of paying them out. But yeah, I don't know. What's the
process
reason for that?
changed this past year. So in the past, we had directly paid PRC for basically their part in the survey. And this year, TWP basically paid for all of it and then invoiced us for the work that PRC did. So they were kind of like a go-between, and there was some confusion about how that got paid, whether it needed to be through a contract or another means. It was a lot more than we usually are paying TWP. I mean, we usually have like a membership fee that we're paying to them that covers some facilitation and things like that. And so there were some questions that came up about that. We were able to get that answered, and it's I believe if it's not processing, it was already done. It was already paid.
Was there a contract established? Is that what's the problem?
Well, we thought that there might have to be a contract because of the amount, but we were able to basically we were in the end able to just pay the invoice and not have to go through a contract process. Otherwise, you would have seen the contract.
Yeah. Typically, aren't there contracts set for was it macro, micro, so over 15,000, there's supposed to be a contract put in place, correct?
Correct.
And their payment was, I assume, over 15,000, so they should have had a contract, correct?
Well, it depends on it depends on what the purchase is. So if
I
they're
thought that was for all contracts that are over 15,000. You have to have a contract if it's over 15,000.
not always through the county, it depends. And so it really depends on what the purchase is for. This, because I think it was looked at as a service and not like a product necessarily, we were able to just pay the invoice. And so we ended up going that route because it was going to be more expedient than going through a contract process, going back and forth.
Because it was already well overdue.
No, because that was the easier way to accomplish the payment.
But that still, I guess it still doesn't explain why the invoice hadn't been paid
I will have to look into that. I
after it'd
can't.
been 6 months.
I would be happy to.
Let's work it out, because.
I would be happy to answer that question for you, but I don't know off the top of my head right now that answer.
Okay. Any other legislative updates? Okay. Any questions on the reports? All right. With that, next meeting is scheduled for July 16th. Is there a motion to adjourn?
So moved.
Motion second. Roll call.
Wade, who has left. McNally.
Yes.
King. Festerson.
Yes.
Jones. Rogers.
Yes.
Espinoza. Wilkin.
Yes.
Weiss.
See you all next month.